We often hear about the opioid epidemic from the perspective of those who are addicted.
But what about the other side of the coin? People who use prescription opiates as a means of treating chronic pain. Alyssa Paldo takes a look at the other side of the opioid epidemic in this WMBD special report.
Jennifer Bowersock lives her life day to day.
I am in pain from the second I wake up to the second I fall asleep.
Open heart surgery put her on a painful road to recovery.
Some days I'm good. I can get out of bed, function normally, and then other days it's very depressing. You just can't move. I can't get out of bed.
She takes prescription opiates to take the edge off and help her sleep. And 3 years later, she can't imagine life without them.
I probably wouldn't be able to function at all.
For Sherry Burdick, it was a diagnosis with degenerative disc disease 10 years ago. Debilitating pain put her out of her longtime job in the school cafeteria.
I have a new normal. It's not the normal that I used to have.
Physical therapy and injections didn't help with the crippling pain. Prescription opiates help her do more of the things she loves, like cooking and spending time with her grandkids. Sherry has been on her medication for 5 years, and in that time has seen changes with every trip to the pharmacy.
They've cut it back. You can't get it early. I mean, if you pick up your prescription on a certain day, it's exactly a month later that you can get it, not a day sooner. They're very strict with it.
But if anyone understands why new guidelines are being put in place to limit the supply of opioids available, it's Sherry.
My younger brother died from an overdose of opioids. So yes, I can see both sides of it.
Most people don't realize the other side of the coin, that legitimate pain patients are getting caught up in the hysteria over the opioid.
Mike Meinsinger is owner and pharmacist at Alwyn Pharmacy. He says if prescriptions are going to be cut back, it needs to be done gradually and humanely.
I'm just seeing reports of people who are being suddenly taken off of them. You know, their suicide rate goes up, or, you know, alternatively, then they switch to street drugs because they can't get the prescriptions anymore.
It's a bedeviling situation.
Dr. Dennis McManus is director of the Central Illinois Pain Clinic. When it comes to prescribing to his patients at the clinic, he takes a tough stance, telling his patients it's the medicine contributing to their pain.
More people dying than died in the Vietnam War, more people dying at the height of the AIDS epidemic. People are dying. And the question is what's going on. And my standpoint is that there is just no good evidence for the use of chronic opioids in chronic pain.
Dr. McManus says the evidence shows long-term opioid use actually increases our sensitivity to pain.
The best way to avoid the problem is not to create the problem in the first place.
The Centers for Disease Control published a guideline for prescribing opioids for chronic pain in 2017. In it, the CDC says clinicians should prescribe the lowest effective dosage and should prescribe no greater quantity than for the expected duration of pain severe enough to require it. Going on to say 3 days or less will often be sufficient. More than 7 days rarely needed. If the benefits don't outweigh the harms, they should utilize other therapies and work with patients to taper opioids to lower dosages or discontinuation. Still, for patients like Sherry and Jennifer, they wish they didn't need this treatment they call life-changing.
Try living a day in our life to take them. And somebody that doesn't need them, you're making it that much harder for the people that actually do need them.
In Peoria, Alyssa Paldo, WMBD News.